Plan Sam, thank you. Elementary school kids could start getting vaccinated by early next month if the COVID vaccine is authorized for kids as young as 5.
Now, we told you earlier in the newscast, the White House rolled out its distribution plan today. We wanted to give you more context about what's next for your family.
Joining us right now, Dr. Lucia Benzoni, who's a pediatrician at Hartford Healthcare. Dr. Benzoni, thanks for joining us. Can you hear us?
Yes, I can. Thank you for having me.
So first off, how should parents get ready to get their kids vaccinated in the days and weeks leading up to this?
I think a lot of parents already have their kids ready. I've had young kids in the office asking to get the vaccine already. You know, and children, there's a proportion of children, not all of them, that are actually scared now. And I feel that the vaccine is the only thing that's going to make them not scared anymore.
We obviously have masking in schools in Connecticut. If we see a high number of kids get those vaccinations, what's your outlook on mask wearing in schools?
I've always been an advocate for the younger kids not to wear masks, especially if they've had the vaccine.
So you would suggest for them, if they'd gotten the vaccine, again, of course, this is a state rule right now, but you would have recommended that if they're going to get the vaccine, that younger kids, you said, don't have to wear masks.
Yes, there's a lot of reasons for that. It's not just medical, there's social too. The reading of faces, the innuendos that come across with an expression that I think these kids are really missing out on right now. And with the vaccine, they'll be much safer as far as COVID goes. And children, as you know, haven't had a horrible outcome in the COVID pandemic like the adults have. And the vaccine is just going to make it even less horrendous for them. I think it'll make it much safer for them and much safer for their family and their grandparents.
You know, maybe there's a parent out there that is kind of on the fence. Maybe they got vaccinated, maybe they didn't, but now it's about their kids. And, you know, parents put their kids as priority number one, and they're on the fence about whether to get their child vaccinated. What's your message to that parent who's in that particular situation?
I talk them through it. I ask them what their fears. I address each fear. And one of the big fears is going to be the side effects and the unknown of the side effects. And I get all the time, this is a new vaccine. We really don't know the side effects. And that I acknowledge that. And I say that is true. We don't know all the side effects. But there's been some pretty rigorous studies out there. And there's been around, in that study that Pfizer did, there was 2,298 children, I think. And although that's not a big number as far as studies go, it was a very, very, very well done study, and the results were that the children had very few side effects.
You said very few side effects. Sorry, you broke up there.
And a good immune response, which is really what we're looking for, is that really good, robust.
Okay. Dr. Benzoni, thank you so much for your time. So much more on this in the coming weeks, and I'm sure we'll be looking to you for some expertise as well.
Indeed. Thanks. More to come this hour here on the news at 4 o'clock.